Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Tick bite treatment in 6 essential steps. Ticks, the blood-sucking insects that often live in tall grasses, are parasites that bite and attach to warm-blooded creatures like humans. There are many kinds of ticks, and the bites can appear as a small reddish or black bump or nodule, a blister or bruised area, or the bullseye rash of Lyme disease, spread by the deer tick. /r/n/r/n Although most tick bites are not harmful, ticks can transmit diseases, some of them serious, if they're not treated promptly. It's essential to properly follow steps to take after a tick bite and know when to contact your healthcare provider. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Reproduced with permission from DermNet dermnetnzorg 2023. /r/n/r/n Ticks must attach to you to spread diseases. If you have been in an area where there may be ticks, do a tick check afterward. Pay close attention to your scalp, armpits, ears, waist, and navel, as well as the rest of your body. If you find a tick, do the following as soon as possible. /r/n/r/n Don't use nail polish, Vaseline, petroleum jelly, or heat to try to make the tick detach. These are unreliable methods that can delay tick removal. Your goal is to remove the tick as quickly as you can. /r/n/r/n Keep the tick in the tweezers, put it on a paper towel or tissue, and take a picture of it. That will help a healthcare provider identify what kind of tick bite you and if it is one that can cause disease. You may not need to see a provider, but it's a good idea to take the photo. /r/n/r/n You can dispose of the tick by putting it in sticky tape and putting it in the trash, or flush it down the toilet in a piece of tissue. If you would like to bring the tick itself to a healthcare provider, place it in a sealed container with a little rubbing alcohol. /r/n/r/n The Centers for Disease Control and Prevention, CDC, does not recommend sending a tick to a commercial lab yourself, as the results may not be dependable. /r/n/r/n After you remove the tick, it's important to cleanse the area. Use warm water and a gentle soap to cleanse your hands and the bite. You may also, or instead if soap and water are not available, apply antiseptic, such as rubbing alcohol or an iodine scrub, to kill any germs on the bite. /r/n/r/n It's not necessary to cover or bandage the bite afterward. /r/n/r/n If you cannot remove the tick because it's burrowed under the skin or it's too hard to grasp, see a healthcare provider. Most ticks don't cause disease. Still, there are close to 500,000 cases of tick-borne disease a year in the United States. /r/n/r/n Watch for symptoms for 30 days after a tick bite. If you see any of the following, contact a healthcare provider. /r/n/r/n Seek immediate medical care if you develop any of these signs. Some may indicate a skin infection that needs treatment, while others may indicate a tick-borne disease. /r/n/r/n If you develop symptoms of tick-borne disease such as Lyme disease or Rocky Mountain spotted fever, your healthcare provider may prescribe a course of antibiotics. /r/n/r/n In some cases, a blood test can help identify whether you are at risk and which illness you have. If you took a photo of the tick or have kept it in a safe container, show it to your healthcare provider so your provider can choose the best treatment. /r/n/r/n The CDC does not generally recommend taking antibiotics after a tick bite if you don't have symptoms. If you live in an area where Lyme disease or other tick-borne diseases are more common, you can ask a healthcare provider about a single dose of the antibiotic fibromycin, doxycycline, which may prevent Lyme disease from developing. /r/n/r/n Even if a tick bite does not present a disease risk, it may still itch or cause discomfort. Here's what you can do at home to relieve the symptoms of a tick bite when you know that it is not from a tick-borne illness. /r/n/r/n The bite should heal within a few days, or it may take up to 2 weeks or more. /r/n/r/n To prevent ticks from getting to your skin and biting you, wear long sleeves and pants and use insect repellent. The second line of defense is checking yourself and/or your body for ticks and taking a shower. /r/n/r/n If you have been in an area that may be infested with ticks, check your body afterward to see if any ticks are attached to you. If they are, it's important to remove them quickly because they can carry disease and make you sick. /r/n/r/n Remove the tick carefully with tweezers and take a picture of it. If you develop flu-like symptoms, pain, swelling, or drainage from the bite, contact a healthcare provider. Most tick bites do not cause disease, but if you do have one and give it prompt attention, a short course of antibiotics can often treat it. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.